In the global race to secure vaccine supply, Australia bet big on the AstraZeneca jab, almost 54 million doses on order.
I would be delighted to have the AstraZeneca vaccine.
Personally endorsed by the Health Minister and a former Prime Minister, faith reaffirmed by the Chief Medical Officer today.
I can absolutely say that I remain confident in the AstraZeneca vaccine.
That's despite the European Union's four biggest nations, Germany, France, Italy and Spain, joining several others in suspending rollout.
Today's decision is a purely precautionary measure.
Prompted by concern the vaccine had caused blood clots in a few cases.
There's just not the imminent risk here in this country, so why don't we pause and take a breath?
A view from the government backbench supported by a former Liberal turned rogue.
To continue it here in Australia under those circumstances is reckless and unconscionable.
They are divisive and they further undermine a vaccine rollout that is already way behind schedule.
17 million people have had the AstraZeneca vaccine in Europe, and there have been just 37 reported cases of blood clotting. AstraZeneca's own clinical trials found 4 cases of blood clots in people given the vaccine, but 8 in the placebo group.
I just want to make it very clear that here in Australia, safety is our first priority.
At issue is whether the AstraZeneca vaccine is affecting platelet levels in those inoculated. Platelets are what helps blood to clot, and some people who've experienced clotting after the vaccine have been showing a low platelet count.
From my perspective, I do not see that there is any specific link between the AstraZeneca vaccine and blood clots.
The government clearly, unequivocally, absolutely supports the AstraZeneca rollout. It will help save lives and protect lives.
Experts adamant any risk is far outweighed by the benefits.
I don't believe there's enough evidence at the moment for us to pause or stop our vaccine program.
There is a downstream consequence of suspending potentially life-saving health programs unless we're really sure that there is a reason to do so.
Public confidence in vaccines is as valuable as the vaccines themselves, especially when Australia has invested so heavily in sovereign capacity to produce 50 million AstraZeneca doses at CSL's Melbourne plant. As well as being the vaccine most Australians will receive, the AstraZeneca jab will be a big part of the regional vaccine distribution, with details expected tomorrow on a rollout to our nearest neighbour, PNG, which is dealing with a worrying outbreak. Andrew Probyn, ABC News, Canberra.